it's the same one.
Topaz was a 19-week-old kitty that was found and rescued. Starting in early May, we started showing signs of being off balance and having an abnormal gait. Just being a poor doer and not really gaining weight, not eating well, having a difficult time swallowing. On examination today, we were thin, and the most profound finding that I noticed is if we laid Topaz on his back or pointed his nose at the sky, we saw vertical nystagmus, so his eyes would go up and down. And that's abnormal. That suggests a problem in the central vestibular system. And the thing that we worry most about in a young cat with central vestibular signs is feline infectious peritonitis, or FIP. So prior to pursuing an MRI, we're going to submit some tests for that. It had already been tested for and it was negative, but that was like 2 months ago. So we're going to resubmit that before pursuing any further tests. And the possible causes of back pain are things like slipped discs. We worry about things like meningitis. We worry about broken bones. We worry about infections of bone, infection of the spinal cord, infection of the nerve. We worry about cancer. So those are the things that we worry about. So fast forward, we've got these x-rays of her lower back. And x-rays are really good screening tools. They're relatively inexpensive. And the reason that we do x-rays are to look for obvious problems in the bone, like obvious cancer of bone, obvious broken bone, but sometimes we can see infection of the bone. And based on her x-rays, I am suspicious of infection of the bone. X-rays aren't the best way to look at the spine,
Right.
But based on the x-rays we've got, I'm most concerned that it's something like an infection.
Yeah.
So an infection of the disc and the bones is what we call discospondylitis. So disco just means the disc. Spondylo means the bones on either side, and itis means inflammation, or in our case, infection. So, and we commonly, the most common disc site for us to see that is the one that we are suspicious of based off of her x-rays, what's called L7S1. The most common infectious causes are bacteria. Bacteria like staph, strep, E. coli. Occasionally we can get a type of infection called brucella. It's less common, but the reason that we bring it up is because it is something that people can get from dogs, so we should test for that. So we are looking at the MRI of the lumbosacral spine of a 3-year-old dog, Airedale Terrier, that presented to us for back pain. We had a wound in the tail area that had cleared up, but then after that we presented for back pain. So on the MRI here, we're looking at a T2 weighted sagittal image of the lumbar and sacral vertebral column. Dogs have 7 lumbar vertebrae, so this is L7, L6, L5, L4. This is the spinal cord here that comes down to a taper. In between each bone is a disc, and we can see that each disc is nice and hydrated, it's nice and bright. This one is not quite as bright, but then when we look here, we see one that the end of L7 and the beginning of the sacrum are just darker and what we call sclerotic. And the disc, instead of it being this nice disc shape, it's kind of S-shaped or curved. If we zoom in a little bit, we can see that right here. So this next image is what's called a stir image, and all that does is sort of subtract certain things and make other things more brighter or more accentuated. So we can really see that bright disc here on the stir image. So I'm gonna cut that one out there. So what this image on the right here is after we've given contrast and we've subtracted out all of the signal from fat. So fat up here is bright, fat over here is dark because we've subtracted that. And this picture is a slice made right where this green line is. So this is the fat on the back, these are the muscles on the back, this is the bone of the vertebra of L6, and this is the spinal cord and nerve roots traveling towards the tail. And what I'm going to do is scroll backwards or scroll towards the tail, and you'll see a new picture and new line here. And as we scroll back, we start to see, once we're in L7, we can see the bone here, but then we start to see this abnormal amount of contrast enhancement within the disc and the end plates of L7 and the cranial aspect of the sacrum. So this is the classic appearance for discospondylitis, or infection of the intervertebral disc and the adjacent end plates. Treatment of discospondylitis involves long-term antibiotics, ideally which are based off of culture and sensitivity of the actual type of infectious organism that we find in the disc. It's not easy to culture the disc. It's a little bit more involved, so many times we try and find the type of infection elsewhere in the body. Sometimes it can be in the blood, sometimes it can be in the urine. So we submitted a urine culture. That'll take a couple days to get that result back. We submitted some blood work for brucella. That'll take a couple days to get back. And once we get those results, we will determine which antibiotic to use. So we're doing a ventral slot here. I'm using a drill to make a window in the bottom part of the bones of the neck. What we're looking at is C3 is the bone on the left, and C4, the fourth bone, is the one on the right. And you can see as we're removing a large amount of fibrous disc after making this window. And that disc is compressing the spinal cord. So as I gently tease it out here, we relieve the compression. Some of the disc came out very easy. Some of it was a little bit more tightly adhered and took a little bit more teasing to get out. But we removed the disc and the compression. So Zeus is going home today. Zeus is the 9-year-old castrated male pug that we met a few days ago, 4 or 5 days ago, for acute onset of inability to walk in all 4 limbs. So he was non-ambulatory tetraparetic. There was minimal to no movement in all 4 limbs. We found a slipped disc at C3, C4, as well as a smaller one at C4, C5. We operated on both of them because they both were compressive. The concern was that C3-4 was the bigger one, the fresher one, so we operated that one first, but we also operated on C4, C5. He's improving daily. He's not quite walking, but I think he's going to do fantastic. So he's going to go home today, and we'll see him back in about 10 to 14 days to check on his progress.